Hello, my name is Arrice, and I'm an investigator with the MyVoice team. I'm here today to talk about some of our polls related to mental health. We know that mental illness has not been improving for young people. The most recent YBRSS show that over 30% of high schoolers report feeling persistent sadness or hopelessness. Because depression, anxiety, and other mental illnesses are prevalent among this age group, we wanted to know what you think about mental health care. We asked MyVoice participants a series of questions, including, how would you know when to seek help for an emotional or mental health concern? Who would you want to talk to about it and why? What are the reasons that people your age might not seek care for emotional or mental health concerns? And what's one thing that could improve mental health for people your age? Overall, MyVoice youth recognize that mental health problems are a huge concern for people their age. The majority said that mental health is important to them and just as important as physical health. Youth told us things like, I think taking care of your body starts with taking care of your brain. Many youth have personal experience with mental health problems, but they varied in their use of therapy and mental health care. Without therapy, I received the medication I was put on for my depression and anxiety. I can't confidently say I would be alive today, was what one of our participants said. Others said that I still don't know how to actually get care. I wish I would have received therapy when I was depressed. Our insurance just doesn't cover it, and everyone in my family suffers from depression, and it's important to have care. Now see, it's not that youth didn't want mental health care. They did, but they faced barriers in getting to care. For example, youth described the need for more affordable and accessible care. Some youth suggested things like public access to helplines or therapy would be great to take the cost out of getting mental health. Other responses were that making mental health care cheaper and more accessible to teens, having an in-school counselor that's available, or being able to be open about what we're dealing with and how we feel. In addition, many youth had experiences with parents or other adults who made them feel like seeking mental health care was a waste of time. When asked why youth might not seek care, they said things like, people who think it will pass might not seek care. People who are told it is a phase and to just get over it might not seek care. Another was that people my age are made fun of by older generations for having these issues. We are too soft or we are too sensitive. Lastly, another said that their parents might have said something about it not being real, or someone could have made them feel bad about it. And that was from one of our 15-year-old participants. One finding that surprised us was that youth by and large preferred trained mental health professionals when seeking help for a mental health problem. Though many would also want to talk to family and friends, they value the confidentiality, trust, and training of counselors, therapists, and psychologists. The main takeaway from our study is that youth are open about mental health needs and are comfortable with mental health care. However, a few things like stigma, access to care, and cost stand in their way. Youth perceive stigma as a big problem, not among people their age per se, but primarily when dealing with adults. Based on the findings of our study, youth experience similar barriers to mental health care as adults. Increasing access to trained professionals will benefit youth who are open to engaging in therapy. In addition, we want to see more youth-serving organizations engaging adults to reduce the stigma related to mental health care. That's it from MyVoice for now. Check out our website, www.hearmyvoicenow.org, to learn more about what youth really think.